Good day, everyone. Welcome to today's video. I'm so excited to dive into a fascinating and highly important topic, the social and professional issues in IT and the impact of IT on healthcare. Technology has revolutionized the healthcare industry, transforming the way doctors diagnose illnesses, how hospitals manage medical records, and how we as patients receive treatment. From electronic health records, EHRs, to AI-driven decision-making tools, IT has made healthcare more efficient, accurate, and accessible than ever before. But with great advancements come great challenges. Issues such as privacy, security, reliability, and ethical concerns play a major role in shaping how IT is integrated into healthcare systems worldwide. Today, we'll explore 4 key areas where IT has significantly impacted the medical field. 1. Computerized patient records. How digital records have improved efficiency and accessibility, but also raised concerns about privacy and security. 2. Clinical decision support, CDS. The role of AI in assisting doctors with diagnosis and treatment and the ethical issues surrounding it. 3. Computerized provider order entry, CPOE. How automation has reduced errors in medical orders but has also introduced new challenges. 4. Telehealth. The rise of remote healthcare services, their benefits, and the obstacles they face. By the end of this discussion, we'll have a clearer understanding of both the incredible benefits and the pressing challenges that come with IT in healthcare. Let's get started. First is computerized patient records, the digital shift in healthcare. Let's begin with something that has completely transformed the way patient information is stored and managed. Before the digital revolution, hospitals and clinics relied entirely on paper-based records to store patient histories, prescriptions, test results, and treatment plans. But let's be honest, paper files were far from perfect. They took up enormous amounts of space, were prone to human errors, could be easily lost or damaged, and were difficult to access in an emergency. Enter EHRs. Now healthcare professionals can access, update, and share patient data instantly, ensuring a smooth flow of information across different departments and specialists. The key benefits of computerized patient records are efficiency. Doctors and nurses can access a patient's records within seconds, reducing treatment delays. One of the biggest advantages of EHRs is their ability to save time and reduce treatment delays. With paper-based records, retrieving a patient's medical history, test results, or previous prescriptions could take hours or even days if records were misplaced. Now, doctors and nurses can access a patient's records within seconds, enabling them to make faster and more informed decisions. Fewer errors. Handwritten notes are often difficult to read and can be misinterpreted, but digital records eliminate that risk. Medical errors are a major concern in healthcare, and illegible handwriting in paper-based records has often led to misinterpreted prescriptions, incorrect dosages, or misfiled documents. EHRs completely eliminate these risks by digitally recording and standardizing patient information. Better coordination. If multiple specialists are involved in a patient's care, a centralized digital record ensures seamless communication. With EHRs, all medical professionals involved in a patient's care can access the same up-to-date records, ensuring consistency in treatment. This coordination improves patient outcomes and reduces redundant tests or procedures, ultimately saving time and healthcare costs. Challenges and concerns. Privacy and cybersecurity risks. Patient data is highly valuable to cybercriminals. A single data breach could lead to identity theft, financial fraud, or even manipulation of medical records. System downtime. If the digital system crashes, it can disrupt hospital operations, causing delays in urgent care. Unlike paper records, which are always accessible, digital systems are vulnerable to technical failures, software bugs, and cyber attacks. If an EHR system crashes, it can paralyze hospital operations, delaying critical treatments and putting patients at risk. Learning curve. Some healthcare workers struggle to transition from paper records to digital systems. Proper training is essential. Electronic health records, EHRs, have undeniably revolutionized healthcare, improving efficiency, accuracy, and coordination. However, their success depends on strong cybersecurity protections, reliable backup systems, and thorough training for healthcare professionals. EHRs have brought huge advantages, but keeping them secure and ensuring healthcare workers are properly trained is critical for their effectiveness. Next is clinical decision support. CDS, AI in medical decision-making. These advanced systems analyze massive amounts of medical data to assist doctors in diagnosing conditions, recommending treatments, and even predicting patient outcomes. Imagine a doctor entering a patient's symptoms into a CDS system. In seconds, the system compares the symptoms against thousands of past cases and suggests possible diagnoses. However, while CDS systems offer significant advantages in improving healthcare outcomes, they also come with ethical and practical concerns that must be carefully managed. The key challenge is ensuring that AI complements, rather than replaces, human expertise in medical decision-making. Advantages of CDS systems are faster and more accurate diagnoses. AI can detect patterns that even the most experienced doctors might miss. Traditional diagnosis relies on a doctor's knowledge, experience, and intuition. However, AI-driven CDS systems can compare a patient's symptoms, medical history, and test results against millions of similar cases, identifying potential conditions with greater speed and precision. Fewer medical errors. The system flags potential drug interactions or incorrect dosages before they become serious problems. CDS systems help mitigate these risks by providing real-time alerts and recommendations. By acting as a safety net, CDS systems reduce preventable medical mistakes, improving patient safety and quality of care. Additionally, during public health crises, such as the COVID-19 pandemic, CDS systems played a crucial role in analyzing patient data, predicting outbreaks, and recommending best treatment practices based on real-time global research. Ethical and practical concerns. Over-reliance on AI. AI should be a tool to assist doctors, not replace their expertise. Doctors must maintain critical thinking and independent judgment, rather than blindly following AI-generated suggestions. For instance, if a CDS system recommends a highly aggressive cancer treatment, a doctor must still consider factors like the patient's age, quality of life, and personal wishes before proceeding. AI cannot replace the human touch in healthcare. Liability issues. If AI gives an incorrect diagnosis, who is responsible? The doctor, the hospital, or the software developer? Currently, medical malpractice laws do not fully address AI-driven errors, creating legal uncertainty. To address this, policymakers may need to establish clear guidelines on AI accountability, ensuring that both doctors and AI developers uphold high safety and ethical standards. CDS systems have great potential, but they must be used responsibly, with human oversight and ethical considerations in mind. Next is computerized provider order entry, CPOE, automating medical orders. Let's talk about how automation has changed the way prescriptions and lab tests are handled. With computerized provider order entry (CPOE) systems, traditionally doctors would write prescriptions or test orders by hand, or give them verbally. This led to major issues like illegible handwriting, miscommunication, and dangerous medication errors. Benefits of CPOE are: no more handwriting errors. One of the most common causes of medication errors is poorly handwritten prescriptions, which can be misread by pharmacists, nurses, or other healthcare professionals. By ensuring clear and accurate prescriptions, CPOE greatly reduces medication errors and enhances patient safety. Improves workflow. Orders are sent directly to pharmacies and labs, reducing delays and improving patient outcomes. While CPOE brings many advantages, successful implementation is not without challenges. Issues such as technical failures, resistance from healthcare workers, and high costs can impact adoption and effectiveness. The last one is telehealth, the future of remote healthcare. Telehealth exploded in popularity during the COVID-19 pandemic, allowing patients to consult doctors through video calls, chats, and remote monitoring devices. Key benefits of telehealth are: better access to healthcare. Patients in rural areas or with mobility issues can receive medical care without traveling. Reduced hospital overcrowding. Non-emergency cases can be handled remotely, freeing up resources for critical patients. Cost savings. Both patients and hospitals save money on transportation and facilities. Challenges and drawbacks. Digital divide. Not everyone has internet access or knowledge of how to use telehealth tools. Limited physical exams. Some conditions require in-person diagnosis. Data privacy risks. Strict security measures must be in place to protect patient information. Despite its challenges, telehealth has transformed healthcare accessibility, affordability, and efficiency. By overcoming technological, diagnostic, and security hurdles, telehealth can become a permanent and reliable part of modern healthcare systems. The future of IT and healthcare technology has transformed patient care, improved efficiency, and made medical decisions more accurate. However, with these advancements come critical responsibilities. Ensuring the security of digital records, minimizing ethical concerns in AI-driven decision-making, and making telehealth services accessible to all are challenges that must be addressed. The integration of IT and healthcare must be continuously improved through collaboration between medical professionals, IT experts, and policymakers. Regulations and guidelines must evolve to keep pace with technological advancements while prioritizing patient welfare. As IT continues to shape the future of healthcare, finding the right balance between innovation and ethical responsibility will be crucial. The potential for IT to revolutionize healthcare is limitless, but its success ultimately depends on how well it is implemented and managed. Thank you for watching. If you found this discussion informative, don't forget to like and share this video. Peace out.